Well, hello and welcome, everybody. Good morning or good afternoon or good evening, depending on where you are in the world. Very excited. I'm Gustavo Tolosa. I'm the webinar coordinator and host for these weekly webinars with Dr. McDougall, and I can see all of you logging in. Thank you for being loyal guests to the webinars. We also always have new guests who join us, and I am in Dallas, Texas, and I am, as you know, all of you know, I have followed the McDougall program for over 3 years now, and lost many pounds, over 70, and kept them off, and turned around my health. And I'm passionate about it, and I asked Dr. McDougall to do these webinars, and he's so generous that he's been doing them now for over a year, and we're all thankful for his time. And I know because you all write me about how much these help you. So today we have a very important topic, because it's a topic that needs to be discussed. There are vulnerable among us, children and senior citizens and other people that need help, that sometimes they cannot stand up for themselves, and they're being in some ways abused with food. And they're getting sick, and they're given food in hospitals and nursing homes that keep them sick. And we want to know what's going on and maybe what we can do to start changing this. So Dr. McDougall, you are in Santa Rosa, California, and I want to welcome you today and tell you how excited we're to having you once more.
Once again, we have a lot of other interesting guests. I think we have Dr. Lau coming up next week, and
yes,
Dr. Lau was with us the week before, so there's a lot of support here. And I don't know, maybe I'll run out of things to talk about, but so far I haven't. I haven't been at this for a long time, 45 years. So anyway, we were going to talk about abuse. Civilized people take care of the least privileged. Civilized people take care of their children. I mean, that's just part of civilized people, whether you're talking about people that lived 10,000 years ago, communities, or people in the current world. They take care of their children. I mean, they might fight and kill each other as adults, but they always take care of their children. And that's not been the case recently in the United States and in other parts of the world. Europe is a good example. Greece boasts the highest incidence of childhood obesity. Italy, I believe, is number 2. The US and Canada come around 5, 6. And so what you see is these children who should be active, healthy, free of disease, trim, athletic. You see them in an exact opposite case. The statistics you probably heard are over a third of the children are overweight, and 17% are so fat that they're declared as obese. And this has to be painful. Even though it seems that the norm is now to be fat and obese. I walk through the supermarkets and different places around, and I see there's so many overweight people that maybe they've come to the point where they say this is normal to be fat, but it's not normal, and it's not healthy. Regardless of how many people try and tell you different, the scientific research and the obvious condition tells you that this is not normal, this is dangerous, this is not healthy, and in my opinion, this is not attractive. Now, people's opinions on attractiveness vary, but I was raised in a time when attractive people were trim and athletic looking, and they weren't obese. So you can argue about that as long as you want. So we have kids, children who are obese, but that's only part of the problem. I used to be a general practitioner. And commonly in my office, when I was a GP, children would come who were terribly constipated. They'd have a bowel movement every 3 to 15 days. I remember as a child myself, even though my parents' intentions were to take the best care they could of little Johnny because he was the greatest love in their life, I can remember as a child having just such horrible constipation and pain. And I mean, there are stories I'd be too embarrassed to tell you about my relationship with the toilet and how much I suffered. And children this is common. This is common every day. I saw it as a person, as a young child. I saw it in my general practice, the terrible suffering that goes on. My grandchildren recognize it in their classmates. My children recognized it in their classmates. You know, they ask questions like, you know, why does Linda spend a half an hour in the bathroom and make these terrible sounds? These sounds. You know, they don't understand it. Well, they do, but it is so common. I have no doubt every elementary and middle school teacher knows their children well enough to know that they're suffering horribly from a constipation caused by the Western diet. And I'm talking about a diet of refined foods, but also dairy. Dairy protein itself has a severe constipating effect. There was a study published in the New England Journal of Medicine in 1998 where they took severely constipated children. To get in this group, you had a bowel movement every 3 to 15 days with the use of a laxative. And all they did was take them off cow's milk. And about 70% of them were completely cured of their constipation. And it wasn't just that the cow's milk lacked dietary fiber, it's that the cow's milk protein has an interaction with the bowel wall, which paralyzes it. They did sigmoid exams on these little children. You can imagine this scenario. A little child, a little boy or girl laying there on a cold table, usually a burly man. It's got this rigid tube that they force up their butt and take biopsies. And that was what this experience was about. The emotional, mental trauma, plus physical trauma on these children is for a lifetime, just to do the examinations. And that, of course, culminates after years and years and years of painful, constipated, bleeding bowel movements. Anyway, the children are sick. They have joint pains. They have headaches. They have oily skin when it gets into the teenage years or even before. What happens is this oily skin feeds bacteria. They grow deforming acne, which is easily prevented and cured with a healthy diet. The other thing that happens, which, by the way, you don't want to tell the children about this, as I remember it, we all want to grow up soon. We want to be, when we're 8, 9, 10 years old, we want to be 14, 15, 16 as quick as we can. Well, you can get there quicker by eating the Western diet. What happens by eating the meat and the dairy and the lack of plant foods on the Western diet is you suffer from precocious puberty, which means you become capable of reproduction, of having children, about 4 to 6 years earlier than intended. Little boys, they start to grow facial hair at about age 11. Little girls, little white girls start to grow pubic hair and breast buds around 10. Black girls, in a study that was done probably 15 years ago, it's, I'm sure, worse now. Black girls, half of them develop puberty at age 8. That means they're getting breast buds and pubic hair, and 3% of them are going through puberty at age 3. The bleeding part, the menstruation, is supposed to start around 16, 17, 18 years old for a girl, and the male full function should start a couple of years later. Well, the truth is little girls are starting their menstrual periods when they're 8, 9, 10, 11, 12 years old. This is abuse. Now, as I say, for some kids, if you tell them that, they say, oh boy, now I have a way of growing up faster, and it may not go well. I can remember one of my sons, my older son, taking my younger son aside and saying to him, the reason you don't have any hair yet is because of the way mom and dad feed you, because all the other kids had hair. And they were growing tall and strong, and they eventually became stronger and taller than their classmates. But it was delayed in the sense of what the community is used to. It was normal in the sense of the way it's supposed to be. You're not supposed to be thinking about sex all the time and being able to reproduce and have children when you're 11, 12, 13 years old, or even earlier, 8. You're supposed to be riding your bicycle and playing checkers and learning your geography. That's what you're supposed to be focused on. But once these sexual changes take place because of the diet, how, if I'm talking to any adults of any age, how strong these sexual feelings are and how they can overwhelm your life. Well, you give these kinds of sexual desires to a child who is intellectually and emotionally immature to handle these kinds of feelings. It's just chaos. It's chaos in the child's life, in the family's life, in the community, in the school. It causes this terrible disruption because of this premature sexual maturity, precocious puberty. That's child abuse. And we know the cause, we know the cure. We could change all of society by getting our kids fixed. It would change the crime rate, the rate of sexually transmitted diseases, all kinds of loss of educational opportunities for young girls is a real problem because of this early onset of maturity. Let's see, what else? How else? What are the obvious signs of abuse? The kids can't run like they should. They don't have the endurance. They can't play the sports that they should be able to play at the level that they should be able to play if they ate a proper diet. We've talked before about how carbohydrate, sugar, is the primary fuel for winners, athletic winners. Well, anyway, it goes on. It's ignored. I'm sure the pain is there for the families and the child, and nobody takes action, and that's because the truth is not being told. And it's not being told because there's no money in telling the truth. In the meat and the dairy industry, if there was any profit for them telling the public that, or the United States Department of Agriculture, that you're ruining your children in so many ways by feeding them the wrong kind of food, then things might change. As it is now, nice people are abusing their children. Teachers, they abuse their children with this diet. Ministers, police officers. This is normal behavior. If these similar things were done with a stick, if an adult took a stick and hit a child in the stomach and caused the pain that's caused by the constipation, or hit them on the joints and caused the arthritis that is caused, or one way or another, I don't want to explain this wrong, but give them the sexual premature type of thinking. If they gave them a pill that caused that, these people would be put in jail. We realize what a crime it is, but it goes on, and no one's paying attention to it. You'd think it'd be headline news. And the solution, by the way, for those of you who are just listening, is you feed a child the right kind of diet, and that is they're breastfed exclusively for the first 6 months, no water, nothing else. At 6 months, they have hands that can reach out and grab food from mom, and they get teeth so they can chew this food. So you add starch to their diet, like sweet potatoes and rice cooked. And maybe some fruits and maybe some vegetables. And the fruit, vegetable, and starch matter increases till they get to be about 2. The breast milk decreases. The proper is not the word, but let's just say the common time of weaning is about 2 years of age. You can certainly feed a child longer, and most will do well if you breastfeed them fewer than 2 years. But I think 2 years is a good goal. And then the children go on a diet of starches, vegetables, and fruits, maybe a little extra nuts and seeds because they're more active and you can get calories easier. But that's not what they're fed. Their go-to food is cow's milk. So they get allergies, they get arthritis, they get the constipation I talked to you about. Remember, 70% of the kids who are severely constipated, and we're not talking about some kid that lives in Arkansas. We're talking about your next door neighbor. 70% of the kids, taking them off the cow's milk, are completely cured of the constipation. And the parents were asked to put the kids back on the cow's milk about a year later. And the parents did. I can't believe they did it, but they did. And every one of the children became severely constipated again. Well, how is that going to change? I actually wrote, let's see, I got it here. There was a, let's just kind of finish this discussion. Florida Governor Rick Scott, in April 27, 2012, he signed a law called HB 1355, which established stricter criminal penalties for individuals who fail to report known or suspected child abuse, especially involving victims of sexual abuse. So, of course, I wrote a newsletter, and I sent it to the governor. and to the state regulatory agency on child abuse. I identified myself as a physician with a Florida license. I'm licensed to practice medicine in Florida. And the consequences of me not reporting this child abuse, or dietitians or psychologists and so on, is very severe. If you don't report this child abuse, then you are, they're going to go after you under state law, or they're supposed to. So I reported the child abuse, and I explained that this child abuse was being done by, with or without knowledge, who cares? They should have the knowledge. It's done by various organizations like Tyson Foods and Crafts Foods and Safeway Market and Ben and Jerry's and the school lunch program and so on. And all these people are at fault of this child abuse, because if any of them would, well, they're not, because it's against profit for these industries. But if they would stand up and say, look, these are our children. These are our children who are suffering horribly. Anyway, well, I wrote that. You can see that in the April 2012 newsletter. So we're going to talk a little bit about child abuse. And the other thing that I think you wanted me to address, Gustavo, is patient abuse. I get about 100 emails a day. I enjoy them. I try and give people the best general answer I can. But I'd say at least half of these emails that I get, at least half of them, are from people, a lot of them with cancer, arthritis, going for heart surgery and so on. They start out and tell me this story about how aggressive and abusive their physician was in their care. Just like I had one this morning about breast cancer. She has metastatic breast cancer, and the doctor, even though she's asking questions, which is the problem, the doctor's being threatened. When she asks questions, the doctor tells her, you're going to die. Stop asking these questions. Being very, very non-professional. And of course, patients are trained to put up with this kind of abuse because the doctor is next to God, and they get away with it. I don't know how they get away with it, but they do. But that happens all the time, and the patient is threatened by everybody on the team, not just the doctor. The doctor's the leader and sets the attitude for the medical office and the hospital rooms and so on. And I don't know if this can be taught out of physicians, because it hasn't happened in the 45 years that I've been in the business. Doctors have treated the patients the same way. And there are exceptions. As I always say, there are exceptions, but this is general medical practice. People are afraid to go to the doctor. They don't feel supported. One of the thoughts that I give people is that if you had a good doctor visit, then you should leave the office feeling better than when you went in. I mean, that's our job. We're trained for at least 7 years to take care of the human. That doesn't mean just, giving the human being some pill. That means taking care of them, their problems, giving them hope and direction and confidence and honesty. And that just doesn't happen. And the reason it doesn't happen is it's not taught in medical school, or at least the importance doesn't come through. The other thing is doctors are very, very threatened. And the reason they're threatened is because the tools they use don't work. It's the emperor has no clothes when you come to chronic disease. Like we've had this discussion recently about how I got a tattoo on my chest that says, "Do not cath, I will sue." And you can see that tattoo if you come to Kauai in January with me. The doctors who have the most to lose, in other words, they're offering the most proven, failing, faulty, useless, harmful treatments. I'm talking about the cardiologist number 2 and the oncologist number 1. They are the ones that are most defensive when you go to see them. Even though, as I showed you, I've given you absolutely all the research, no doctor would ever disagree that treatment of chronic coronary artery disease with heart surgery does not save lives. It's been proven over and over again. But if you as a patient go in, and I've gotten 3 letters in the last 24 hours. If you as a patient go in and you have chronic coronary artery disease, you're just right into surgery. That's the way it is. No time to ask questions, and no alternative given, no honesty given. That's the problem. And if you question the doctor, because the doctor, he or she realizes that what they're teaching is garbage, we've changed my language.
Right.
What they're teaching is not true. They get scared. And when a person gets scared, they get defensive, and they get offensive and abusive. And that's what's going on in your doctor's office. And it happens an awful lot in oncology too, because the treatments are brutal. And they lie about the outcomes of the treatments. Breast cancer, for example. They lie about the outcomes of surgery. They lie about the outcomes of chemotherapy. They overrate the benefits of anti-estrogen therapy like tamoxifen and aromatase inhibitors. They lie about the benefits of radiation. They just plain simple lie. And if you question them, they come down on you with a hammer. So how do you handle this kind of thing? Well, there should be some kind of board that you can report your doctors to. I think there's got to be something on the internet like Yelp that helps you evaluate your doctor-patient experience. If there isn't, there should be. I have no doubt that there is. You can probably read about reports of the physician you're seeing and see if there are some doctors that act like business people, act like they should be acting, which is to help the patient. That's our job, is to make the patient feel better. And if you have a bad experience, don't take it personal. We have a tendency to take it personal. For example, you go to the grocery store, and I put my goods on the conveyor belt, and the cashier starts screaming at me, "Hey, you didn't put it there!" And the first thing I think is, oh, maybe I did something wrong. But what I didn't consider is that she'd had a terrible day. Maybe her husband beat her before she went to work, or one of the kids had it's not me. It's the cashier that's having the problems, but I take it personal. The same thing when you go to the doctor. The doctor starts belittling you and saying things like, "Who went to medical school, me or you? Why are you asking these kinds of questions? I'm the doctor. If you don't like it, go find somebody else." You go, "Boy, I must be a really terrible person for the doctor to treat me that way." Well, no, the doctor's just got some problems. Maybe they're personal problems, and maybe the doctor realizes that what he or she are doing does not work, and they are lying to the patient, and they have to cover it up. I think that's a lot of it. They don't, and the other thing is they don't have tools that work. When you go to all this work to learn how to pass catheters into people's coronary arteries, and then the reports come out and say there's no survival benefit. You're very frustrated by the fact that you spent all this time trying to do good. And I'm sure the doctors wanted to do good, and then you have to deal with the fact that what you're doing is harmful and not good. So you're dealing with something here that shouldn't exist. Again, we spent 7 years. We spent $500,000 on ourselves to learn to help people feel better. And we go out into practice and we find ourselves unhappy. The doctor has to be unhappy too, and find the patients unhappy, unruly, belligerent on both sides. And that shouldn't exist. I'm also in the travel business. You know that. I've been in the travel business for about 30 years. And one of the things that I notice very carefully is how I'm treated by hotel staff, guides, various people. Most of the people in the entertainment, the travel business, have figured out that you got to be nice to the customer, or they will get bad rumors going around, and they won't get good tips. So the entertainment business, the travel business, has learned the importance of taking care of the customer. The medical business hasn't, and I think it's because they don't get punished for acting in the manner that they do towards their customer. They still have enough people coming in that you don't have to be nice. You don't have to be good. There are not enough doctors. We could fix that in two ways. One, which I'd like to see first of all done, is we could stop the sick people. 80% of people are sick because of the rich Western diet. So if everybody got this message and stopped eating the garbage, their type 2 diabetes would go away, their blood pressure problems would go away, their bowels would work, they'd lose the weight, the aches and pains, the arthritis would go away. And that would leave doctors sitting in their offices doing nothing. 20% of the business would be left. That's the way to solve it. We could also produce more doctors. That's been talked about since I was in school 45 years ago, so we need more physicians. And attention was given in my medical school about patient-doctor relationships. So it's not like this is an ignored subject. It just hasn't changed. But the situation is that you don't have to do things right to stay in business. You can be a jerk, and you still will find patients coming in your office, and you can pay the bills. But that could change. That could change. And nothing would make me happier than people to change their diet, stop having heart disease, breast cancer, colon cancer, prostate cancer, and to find my colleagues searching for jobs as Uber drivers, taxi cab drivers, because they deserve it, with exceptions, of course.
With exceptions. Dr. McDougall, since you mentioned diet, and there are some new people here on this webinar, would you just give a little short version of what it is, the STAR solution, and would
two sentences.
Yeah.
Two sentences. And of course, all of this is on the website, free. 2 sentences. The McDougal diet is based on starches. That's what you eat most of. Based on starches, vegetables, and fruits. The McDougal diet does not contain animal foods or free oils, like olive oil, corn oil, and so on. That's what it is. 80% of your diet, 90% of your diet is sweet potatoes or rice, fruits and vegetables. We have probably 600 free recipes on the website. I believe Mary has published over 3,000 recipes that fit with our philosophy. We also have some desserts.
Right.
And exercise is okay. It's not the basic part of the program. It's okay. It's good for you, but you got to be careful. And sunshine is crucial, enough, but not too much. And that's essentially what it is. And what we do is we take people off medication, and they get their health back. And our results are published. They're published October 2014. You can find them in the Nutrition Journal on 1,615 people. And I do want to announce, maybe this would be a good time to announce it, is our paper from Oregon Health and Science University, which was the preliminary study on using diet to treat multiple sclerosis, which has been, in my opinion, proved to treat multiple sclerosis by Dr. Roy Swank, who was head of neurology at Oregon Health and Science University for 23 years, written dozens of papers. I think he has almost 200 papers published, and many of them have to do with how diet, stopping the saturated fat is animal food. It's
right.
Beef, dairy, and eggs. How stopping the saturated fat and going toward a diet like I recommend essentially stops multiple sclerosis. And he's published that. He published it over about 3 decades of work. It's published in places like The Lancet, the American Journal of Clinical Nutrition, and so on. Well, anyway, many of you know, and some of you financially contributed to our foundation, and we started a study in 2009 on the dietary treatment of multiple sclerosis, and it has been a difficult process. The people at OHSU were very enthused because Dr. Swank was the head of neurology there. It was the obvious place to work, and they're extremely talented and also extremely determined to do good science so that no one would question the study and the results. And so they put more effort into it than I could even imagine. But it's taken a long time. We've had, the study was done in 2013. We attempted publication in about 2015. Initially, they wanted to go to the MS journals. They turned them down, and the reason is because the MS journals, multiple sclerosis journals, neurology journals are owned by the drug companies. They suggested we then go to food journals like the American Journal of Clinical Nutrition, and we sent the paper there. I told them beforehand they will turn us down because they're owned by the food companies. Finally, we got accepted by a very good journal. The journal is open access. It cost us extra money to make it available to you right now. You can get the paper. It just came out today, open access. It would otherwise, if we'd have waited a year for you to get it free, we could have spent a lot less money. But the journal requires a big fee to make it open access now, and Oregon Health and Science University paid that fee, even though I was willing to pay it out of our foundation. They paid it, so the study is available to you. And I'll see if I can get it up.
Yeah, I can put them McDougal. I can get it right there for you. Yeah. So this is the study, correct?
Yeah, that's it. It just came out, and we'll put I'll put up on the website a link to it, and Gustavo will put up a link to it also. This study probably cost $1 million. However, I got a lot of deals as I went along, so we only spent about $700,000 on this study. And it's an excellent study. The results did not turn out exactly as I'd hoped, but there's very, very good reasons that are explained in the study why we couldn't show what we wanted to do. But the purpose of the study was to show the safety and the usability or the compliance of people on a diet for MS. That was the purpose. It was a preliminary study to just prove it was safe to feed people this way and that people would adhere to this kind of diet. We proved both of those primary objectives. 85% of the people followed the diet 100% of the time for a year. We also showed, and I don't know whether they got it into this study, they showed the 6-month weight loss, but we had the 1-year weight loss, and the average 1-year weight loss was over 19 pounds, sustained for a year.
Right.
And we had the average cholesterol drops. They were about 22 points. Let's see, no, they were about 20 points in the study. About 20 points, 20 milligrams per deciliter. They were maintained for a year, and that's in this study. The study also explains a lot of very important things in what we did. And I have to say, and I know I'm not exaggerating, that this work that I did with Oregon Health and Science University Neurology Department has changed the world. The MS meetings now, the hottest topic out there is nutrition and multiple sclerosis. One reason is the medications used they're brutal. They're criminally expensive. They cost $75,000 a year for drugs, and they show some benefits which may be relatively insignificant. They show fewer relapse rates. They show fewer new lesions, but they haven't showed a slowing of progression of this disease. And people have to take shots once a day, twice a week. There are some pills that are out there, but they're largely ineffective and extremely costly. And so that's one reason that it's this type of thinking and research and the new change in attitude that's taking place in the multiple sclerosis meetings worldwide is because we don't have any good treatment. We've got these expensive, relatively useless drugs that also can kill people.
Right.
And neurologists all know that. You know, if they had some good treatment, like, heck, you got MS, let me give you this little white pill that costs 3 cents a pill, and you take 2 a week, and I'll never see you again. If they had that, we wouldn't have to go into dietary studies or what do they say, think out of the box. Well, we thought out of the box, and the paper is published. It's up there for anybody to read. It's already changed thinking, as I say, all over the neurology community worldwide, and it's happened at the right time. Things kind of happen in history at the right time.
Yes,
and
they do.
The world is changing.
And this is an article that people can print and take to their maybe doctor or healthcare professionals.
It's open access.
Right.
You can print 10,000 copies, hand it out to your friends.
Right.
That's free open access. So anyway, I hope you do share that. There's a lot of information to learn from that article besides multiple sclerosis and details that are and many of them over my head.
Yeah.
So it's a well worth reading paper for the general public, and it's yours to get right now. There is, maybe if I showed it on my screen, they would at least have the URL address.
Right. I will, when the email goes out with a replay, it will have the link so everybody can get it if they want to get it. But
well, there it is. There it is again. If you put in low-fat, plant-based diet, multiple sclerosis, a randomized controlled trial into Google, it should come up. Yeah. And you see, the other thing I want you to notice is my name doesn't appear until towards the end.
Right.
I actually asked, when we did the study, I actually asked that my name not be on the study. And the reason is because having my name on the study would give people an excuse, well, as done by Dr. McDougal.
Right.
But as it turned out, legally, I had to have my name on the study. But you notice that the primary names on the study are the staff at Oregon Health and Science University, the medical school in Portland. All right, so that was a good read. And
very good.
Do get it? Do get it? Let's see. There's one other thing I want to show you. Let's see if this will be fun for you. Okay, here is preliminary, a preliminary. Has it come up yet? It'll take a minute to load, probably.
Yeah, we can see it.
That's
the cover of your new book.
That's the cover of the new book, which will be out September 27th. I believe you can order it on Amazon right now. If you take a screen capture of this right now, you'll find a lot of errors, so don't. There are some corrections that need to be made.
Right.
But I have some nice endorsements up there from people who are important to me, and you will not be disappointed in the book. It contains the color picture book. It has 3 very well-written chapters in the beginning. It has a couple of dozen recipes that are with colored pictures in them. Even if you own all of the McDougall books, you'll want to add this one to your collection. You'll be very proud of it. And it also is more user-friendly. And so you can give it to rather naive people and say, look, just start out by reading the color picture book. And then you can go on and read the first chapters, try some of the recipes. These are some of Mary's favorite, relatively easy recipes, not as easy as we usually teach you, which is, make a bean soup or bean stew and potatoes.
So while I open the chat box here for people to maybe submit some questions for you, would you comment on something that it's kind of infuriating to many of us? I personally, I have a relative who is in a nursing home, and I go visit him, and I see hamburgers and hot dogs and pizza loaded with cheese, and these are the very foods that that are keeping these people sick. And the same in children's hospitals, where I spent 4 years as a volunteer, and I see kids eating cheeseburgers and things like that. Why is this happening, and in your opinion, and how? What could we do? What could we do to maybe have the hope to see change? Do you know?
Well, okay, as I'm answering this question, your audio to me is coming across very crackly.
Oh.
So I don't know if there's anything you can do about it, but let me answer this. The very foods you mentioned are not only served in hospitals and nursing homes, but if you have a heart attack and you go into the ICU or the CCU, they serve you the very foods that brought you there in the first place. Here you have a teaching moment. An elephant just sat on your chest, and you'd say to the doctor, I would do anything, I would eat anything to not be in this position again. You just cracked my chest open. Put me on a heart-lung machine for 4 hours or 6 hours. I never want this to happen again. Just tell me what to do. And the doctor kind of looks at you and looks over at the tray and says, boy, that's a delicious cheeseburger they brought you for lunch. You're going to get lots of protein for eating that cheeseburger. I've said before, and I do believe strongly, that the food service deserves a kickback from the pharmacy and the surgery department, because they continue to promote the very foods that promote the diseases that provide the business for these doctors and hospitals. The biggest buildings in your towns, the newest buildings in your towns, are cardiac centers, cancer centers, hospitals. This is the only growing facet of our economy, is the healthcare business. It's the medical sickness business. So there's no incentive. Even at an Adventist hospital, I worked at 2 Adventist hospitals. I'm not Adventist myself, but their mission statement, their purpose in life in terms of health, is to keep people healthy and treat disease by healthy habits, in particular a vegetarian, almost vegan diet. You could make an argument that the diet was originally intended to be vegan, even though it was only taught as a vegetarian diet. Anyway, why does it go on? It makes no sense for a nursing home. To me, a nursing home is a logical place to feed the participants a good diet because they keep paying rent every month. And if you can keep them alive, and I'm not sure exactly how the system works, but maybe the nursing home has to pay for medicines or physician visits for the patients. And if that's part of the deal for the nursing home, then they could save a lot of money by keeping the patients healthy. It just doesn't make any sense at all. Yeah, but a lot of things don't make sense.
Well, can you hear me better now? Is it sound?
I still have a lot of your voice is still very crackly. So okay. I think we're after.
Sorry, I don't know what is the problem. Well,
do I sound all right to you?
You sound just fine here.
Good. Well, our viewers are very patient with us, and they know we try hard in technology sometimes.
Sometimes it does not cooperate.
And it could be on my end too.
Well,
maybe everybody else is getting a good listen to you, but I did want to mention it.
All right, thank you. I think that people are asking some questions here about milk for children.
Yeah.
And if you have any recommendations regarding plant-based milk, are some better than others?
Such as soy milk, or let's see, there'd be soy milk and rice milk and those different kinds of milks. No, I don't think so. If you make them at home, it'd be better because most of the ones, as I remember, the ingredients contain sugars and oils. Try and find one that doesn't, that just uses soybean or just rice. When our children were younger, Mary would actually make rice milk for the kids. But you have to pick up the package and look at it. As far as feeding cow's milk to children, that is in the list of the laws and the crimes that I will pass the day I become Surgeon General. I will make cow's milk a poison, identified as a poison, with a Surgeon General's warning that this fluid will constipate your children, damage their arteries, destroy their kidneys, give them autoimmune diseases, and this milk should only be fed to cows in a less processed form. But I don't think I'm going to become Surgeon General. somehow every year I think my chances become lower. And with this political year coming on as it is, I might get fired.
That's right. I am afraid, Dr. McDougall, to continue speaking because for some reason my sound is not working today.
Well, I don't know if it is that way for other people. It just may be my head.
I think so. People are commenting.
Okay.
We are reaching our 45-minute webinar, so maybe this is a good place to stop and announce that next week we have Dr. Lim as a guest.
Good. Well, there's just a couple things. I want to finish that milk statement. You are to feed your children human breast milk, but not whale milk or rat milk or dog milk or cow's milk. It's just the wrong milk. The other thing I want to mention is I was supposed to appear at the World Vegan Conference in Berkeley. I believe it was on the 30th of this month, which would be, not next Sunday, but the Sunday afterwards. But I was fired. I was fired from the Obesity Medicine Conference because I wanted to speak. I wanted to speak clearly and loudly about diets, and we went through all that. You can see that webinar that we did before. And I wouldn't back down because I thought I should tell what I believe to be the truth. And I was invited to speak at the World Vegan Summit in Berkeley, which I believe is the 30th of July on a Sunday. And I just got fired. And the reason I got fired is because of something that I have said for my entire career, and that is I am not a vegan. And the reason I prove it is that every other Thanksgiving I have a 2x2 square inch piece of turkey. And that really, honestly, is my animal food intake for the year. Certainly not much more than that. And the reason I say that, and I've been criticized, I remember a conference, say 25 years ago or so, which was the North American Vegetarian Society conference up in Johnstown, Pennsylvania. And I told people that I have turkey every other Thanksgiving, and I eat a diet of starches, vegetables, and fruits. And the reason that I do that is I don't want people to mistake what I'm teaching with a vegan diet. A vegan diet can be very unhealthy. In fact, often is. The first vegan I ever met was one of my interns. His name was Jeff. He wore plastic shoes and nylon belts and wouldn't hit a fly, but he was fat and greasy, and his diet was potato chips and Cokes. I've always wanted to get away from the concept of veganism as your ultimate goal. I have written articles, newsletter articles, you can find them on my website, called The Fat Vegan. There's a chapter in my book, The Starch Solution, called The Fat Vegan. And no one's ever objected, even though it seems like an oxymoron, the fat vegan, no one's ever objected to the chapter I wrote, or at least to me. They never said, well, that's offensive, you shouldn't have done that, because my goal has been to help some of my closest alliances, which would be vegans. They're already committed. They've already taken the trouble to give up meat and to defy their doctors and dietitians' orders and warnings that they become protein and calcium deficient. They already have people of great commitment and determined to do hard work to save the planet and animals. The one problem is that a fat vegan has trouble communicating to other people about the importance of dietary change, because the other person looks at them and says, and I'll look like you? So I have tried to help vegans understand that they need to eat a starch-based diet, stay away from these fake foods, stop eating the smart balance margarines, the other oils, because that's why they're fat and unhealthy looking. Well, anyway, this is well known. I mean, you've heard me say this same story, write it 1,000 times in the past. And I had a discussion with the head of the Vegan Summit, and he said, is this really true? This can't be true. You can't eat turkey every other Thanksgiving. I said, well, whether I do or not, I say I do. And which Thanksgiving I eat that turkey at is something I keep secret. And I want you to know that the turkey and we sacrifice for you every other year so that you can learn the real message. And that is, you're supposed to be eating a starch-based diet with vegetables and fruits. Now, if I would have come to the conference, hopefully it would have been just a quiet, usual, subdued discussion that I always put on. Just joking. But I know it would have come up. There were some people who are actively upset with me, and have been for years. This is nothing new. I've been challenged on this many, many times. I don't call myself a vegan. There's a discussion on the website, actually, is Dr. McDougall a vegan or not? So you can go look at it right afterwards. But what I'd planned on doing was, maybe because of my nastiness getting older, but I was going to do it in a very professional way, as when I was challenged, which I would have been at the Vegan Summit conference, that it said, you're not a vegan, you eat turkey, and we hate you, and whatever. I was going to say, okay, I understand. And I was going to tell them the whole story that I just tell you, that I just said. And before, someplace in there, I was going to say to the audience, which will probably be a couple hundred people, it'll be a good, fun conference, people aspiring to be vegans. I would ask the people who were vegan, I was going to ask the people who were vegan in the audience to stand up. And they would have stood up, and I was going to ask them, now look around at the people who are standing up who are vegan. Now sit down. What you just saw was an audience where half the people were overweight and some morbidly obese. That's why I don't teach a vegan diet. I teach a starch-based diet with fruits and vegetables. I certainly have my own personal reasons for my concerns about animal cruelty and the environment, which are very strong. And one thing I said 30 years ago to this group at the North American Vegetarian Society is I said, I bet I save more turkeys every year than every single one of you vegans do, because of the perspective I put this in. And you will never know whether I have turkey every other Thanksgiving or not. But I say I do, and that's my official statement, because I don't want you to think, put your efforts into a direction that isn't primary. It's important, but it's not primary. And it would have probably been a very interesting talk that evening. I don't think I would have changed any particular minds. I'm just getting back from a trip to Detroit, Michigan. I really wasn't looking forward to more travel right after arriving. So on a personal basis, it's okay that I'm not going. I would have met some people personally that have been following us for a long time. So I'm going to miss that. But plain and simple, Dr. McDougall is not acceptable to the standard medical drug pushing surgery operating business called the Obesity Medicine Conference. And Dr. McDougall is not acceptable to the vegan movement. But I am what I am, and I'm not going to change. And at least for one thing, I'm consistent and honest.
Yes,
so you are. Planning on going to the conference, and I'm not there. It's because of a last minute change. Somebody found out about something that I've been saying for over 35 years, is that me and the turkey, we suffer for you every other year.
Yeah. Very good. That is very well said.
Yeah.
Thank you, Dr. McDougall. And
Gustavo, I just want to win the war. Not every battle. I just want to win the war. And I've got to take a strategy that is defensible.
Right.
There's been no vegan population I know of that has ever existed on planet Earth of any size, maybe a few vegan monks. But all populations, all large civilized populations, lived on a starch-based diet. And that's what I want to teach. I just want to save the planet. I just want to save people unnecessarily suffering. This is not a religion. And I want to make sure that my focus is on point and you clearly understand what I have to say. But I don't care if you like me or not.
Right. This is not a popularity contest.
This is not popularity.
Well, thank you, Dr.
I'll be in Michigan next week visiting my 92-year-old mother. And Dr. Lau is going to be taking over Dr. Lim, Anthony Lim will be taking over. And you don't want to miss this introduction. This is the doctor who has added so much to the McDougall program. And once you meet Dr. Lim, have a chance to see his humor, his personality, and his extreme intelligence. We have many heated discussions, he and I, about the medical ways of medical treatment and what the medical literature says. But we always have so much fun together. So don't miss seeing Dr. Anthony Lim, who happens to also be an attorney. And I sometimes think if I ever needed an attorney, I'd hire Dr. Lim. If I ever needed a doctor, I'd hire Dr. Lim too. So don't miss next week.
Yes, it's going to be a great webinar. And we will miss you.
Well, I will be back the following week, I believe.
Right.
It'll be a nice change. Thank you, Gustavo. Thank you, folks.
Thank you.
Bye-bye.
Thank you, and thank you everyone for logging in today.